In fine needle aspiration, doctor aspirate fluid as a sample. Will take a fluid as a sample. Doctors will take a fluid as a sample. Then, in core needle biopsy, doctors will take muscle or tissue as a sample. Muscle or tissue as a sample. That is the difference. In core needle biopsy, doctors will take muscle or tissue as a sample. In FNA, doctors will take a fluid as a sample. Did you understand? Did you understand the difference? Yes, ma'am. So, in Intigumentary, this is anatomy. Waste of time.
सर एनेस्थीसिया के चल रहा है अभी तक
Remaining two lesions, 1,008 into 2. Okay, now try this question now. 5 lesion CT guidance.
1,009 and 1,010
4. Correct. So CT guidance means 1,009 and 1,010. So number of lesions 5.
You plugged in this one.
First lesion. Let's please mute yourself. For first lesion 1,009. Then the remaining 4 lesion 1,010 into 4. So our primary code should you report always for the single lesion. Then the remaining lesion we should report the appropriate add-on code. Okay? Did you understand? Now try the same one. MRI guidance 7 lesion.
1,010
into 6. Correct. So total number of lesions 7. MRI guidance. So in that for single lesion 1,011. Then the remaining 6 lesion 1,012 into 6. Did you understand? Did you understand? Any doubt?
Ma'am, key terms are lesions, ma'am, number of lesions.
Sorry, what did you say?
In Intigumentary, the key terms are the number of lesions, ma'am, as like in respiratory and
No. Actually, this is not a big thing. You have to report the code based on the code description. Here, code descriptions are assigned based on the imaging guidance and lesion. Okay, so for the every heading, for the topic, the code description will differ. Okay, first of all, you have to understand the code description. Here, the procedure is FNA. And the FNA means doctors obtain the fluid from the lesion. That is the process of FNA. So, according to the number of lesion and based on the guidance, you have to select the appropriate code. So, this is not a basic guidance. Actually, you have to fetch the code based on the code description only. Okay?
Okay, ma'am.
Okay, did you understand now?
Yes, ma'am.
So 5 lesion 1,009 and 1,010 into 4. Now acne surgery. Acne pimple. For pimple, go for 1 double. For the front of pimple, 10040. For acne surgery, 10040. Direct coding, no guidance here. Okay. Then for incision and drainage. So surgeon may cut and drain the fluid. See the image. This is a process of incision and drainage. Surgeon make a cut and drain the fluid. Suppose that is called as I and D. I and D. I stands for incision. D stands for drainage. I stands for incision. D stands for drainage. So surgeon make a cut and drain the fluid. Suppose if the fluid does not, if a surgeon can't able to drain the fluid, we should not report the code for IMP. Okay, if surgeon can't able to drain the fluid means we should not report the code for incision and drainage. Now, in that, for incision, procedure is incision and drainage. Condition is abscess. Now here we are reporting the code section for integumentary. Okay, not for a particular organ. Not for a particular organ. Here we are going to discuss about integumentary, the skin related disorders. Now, incision and drainage and abscess for simple or single 10060, complicated or multiple 10061. Simple means, so see that the image, package. If package is not applied means go for simple. After completion of the procedure, if a provider does not apply the package means go for simple. Complicated means, suppose if a doctor apply packaging means go for complicated. So with the packaging, complicated. Without the packaging, go for simple. With the packaging, go for complicated. Without packaging, go for simple. So same like that here for a single or multiple. The same code would be applicable for single abscess. One abscess, one cyst. So whatever it is, for single 10060, for multiple 10060. What is the code for 3 abscess, incision and drainage? 3 abscess.
10061.
10061. For a packaging is applying means that is application of packaging.
Complicated.
So with the complicated, with the applying of package should be considered as complicated. Without packaging means go for simple. Then see that incision and drainage of pilonidal cyst. See that our back. Cysts that appear in our back. Same like that. Here also package is applying means if applying of package go for complicated. Without packaging go for simple. So for pilonidal cyst, simple 80, complicated 81. 70 for excision. Excision means removal. Excision means removal. Incision means doctor make a cut and drain the fluid. That is incision and drainage. Excision means removal. Removal of pilonidal cyst for simple 70, extensive 71, complicated 72. Here the informations are given by doctors direct. So So removal of below needle system. So the term simple, that is the severity. Severity will denoted by the provided R. Now, try now. I will explain you. I will give one more question for you. First, I will explain it. After that, I will give a question for you. Now, what is the procedure? 10120. What is the procedure?
Incision and removal of foreign body.
So incision and removal of foreign body. Same like that for simple 20, complicated 21. Then 140.
Incision and drainage of
So for incision and drainage of hematoma seroma means go for 140. 160 is also for hematoma, but it's an aspiration. Aspiration means suction. Aspiration means suction. Doctor suck the fluid. For aspiration of abscess, hematoma, bulla or cyst means go for 180. Then 160. 180 for incision and the drainage of complex postoperative wound infection. Postoperative means in the previous operator site. Patient has suffered by the problem of infection at the previous operated location. So for postoperative wound infection, go for 10180. Incision and drainage procedure is performed at the location of postoperative wound means go for 180. 10180. Direct coding. Now try this question. It will give a better idea for you. Sorry.
ma'am, D. Yeah, ma'am, D. Option D, 1177.
Others? What about others? What about others? Is this the incision and the drainage procedure or incision and the drainage or excision, guys? What is the procedure here?
Incision.
Incision. Am I right? Because doctors can't get the fluid, the blood clot, infections, and urinary disputes. So everything should be clean. So here, debridement should be reported based on the depth. So please take a note, depth of debridement. Please take a note, depth of debridement, subcutaneous, muscle, bone. Depth of debridement, subcutaneous, muscle, and bone. Here, 11042 for subcutaneous debridement, subcutaneous depth. For first 20 square centimeter or less, go for 42. Each additional 20 square centimeter are partigraph. What is the meaning of partigraph here? What is the meaning of partigraph? Yes. Remaining, am I right? For every 20, less than 20 also, we can apply the add-on code 11045. We already discussed about this partigraph in anesthesia chapter. We already discussed about this partigraph in our anesthesia chapter also. So partigraph means for every 20, then less than 20 also we can apply the add-on code of 11045. So 42 and 45 for subcutaneous depth, 43 and 46 for muscle depth. See that the first term. detriment muscle. So that for 43 and 46 for muscle depth, and 44 and 47 for bone depth. So the depth of the detriments are subcutaneous, muscle and bone. Here the corresponding square centimeter that will denote the cleaning surface that does not mention the depth. The square centimeter does not mention the depth. The square centimeters are used to report the cleaning surface. Cleaning surface. Now try this. 40 square centimeter muscle depth. How can we report 40 square centimeter muscle depth?
11043
No. 46.
No, 11043 and 11046.
Only. Because 40, how can we split? 20 plus 20. Am I right? So 20 plus 20. So there are two 20s only present in 40. In that first 20, 11042. Then the remaining 20, remaining only 120 here. Remaining only 120 here. That's why 11042. How can we now? How can we replace the whole? Primary code and add-on codes that first 20 square centimeter or less. Then additional code should also be reported for each additional 20. So that's why here we are splitting the values as 20. So 20 plus 7 for first 20 11044. Then the remaining 7% also we can apply 11047. Okay, because part garam. So for every 20 less than 20 also we can apply the code of part garam.
Ma'am, suppose if it is 47 means we should go for 11047 into 2 or just 11047?
40, how much?
40, 42 or 47, whatever.
Okay, 42. How can we split?
20 into 2.
20 Amara, 20 plus 2. For first 20, 11044. Then remaining 120 and 2 is here. So that's why 11047 into 2.
Okay.
Okay, 11047 into 2. Others, did you understand?
Yes, ma'am.
Now here we have some example. Answers also here. Detriment leg. First, see the first example. Bone 40 square centimeter. What is the depth? What is the depth of that first example?
40 square centimeter. 40 square centimeter.
Talking about depth.
Bone, ma'am.
Bone depth. Here 40 square centimeter that mention the cleaning surface. 40 square centimeter. 40. How can we split that 40?
20 plus 20.
20 plus
20.
So for first 20, 11044. Then remaining only 120 present. So 11047. Now try the same depth. So now the depth is subcutaneous 100 square centimeter. What is the answer? Depth is subcutaneous 100 square centimeter.
11045 into 4.
How many 20s?
5.
5
5.
20. 100, 20, 20, 20, 20 plus 20. So there are 5 20s that are present in 100. So in that first 20, 11044, then the remaining 4 20s, 11045 into 4. The remaining 4 20s, we should report 11045 into 4. Did you understand now?
Yes, ma'am.
Now, see that the second example. Guys, don't write. First of all, I will explain this concept. After that, I will give a time to note all of these information. Okay, don't write. First, please listen now. Now, in that second example, right leg muscle depth 20, left leg muscle depth 20. So, anatomical side is different, but depth are same. Am I right?
Yes, ma'am.
So, anatomical side differ, but depth are same. Here, we have to add the value. That means 40. We have to take it as a 40 square centimeter. Same like that. For muscle 20 square centimeter, 11043. Then the remaining 120, 11046. Here depth are differ. Okay, depth are differ. Sorry, depth are same, but anatomical side are different. So if a depth are same means you just add the value and give a code. Now take example. I need an answer from every one of you. Take this example. Right leg, bone depth 12 square centimeter. Depth bone 12 square centimeter. Left leg bone depth 10 square centimeter. So right leg bone 12, left leg bone 10.
Double 1044 and 11047. 4.
Others?
Only single code.
Single code. Okay. Others? Any other answer? So right leg muscle, right leg bone. What is that measurement?
12 centimeter.
Now, the right leg bone depth, okay? Bone depth 12. Am I right?
Yes, ma'am.
12. Then same like that, left leg. Depth is also same, bone, but 10. Now, here anatomical side are different, but depth are same. So, you must add the value. 12 plus 10, how much?
22.
12 plus 22. So, now we have to split the code as 20 plus 2. 20 plus. So, for first, 11044. Then the remaining 2 square centimeter, 11047, right? 7. Okay. 11047. That's so 11044 here. Depth anatomical side are different, but the depth are same. That's why here first we have to add the value 12 plus 10, 20. 22. 12 plus 10, 22. So after you have to split the code, split the values as 20. So 20 plus 2, in that is 11044. Then the remaining 2, 11047. Clear now?
Yes, ma'am.
Yes. Take this example also. Take this example now.
Ma'am, please once repeat part to the rough meaning.
Part to the rough means for every 20, For less than 20 also, we can apply the addendum. That is a mean. Here, in this example, remaining 2. Okay, remaining 2, that means less than 20. For less than 20 also, we can apply the addendum. That is a mean. Part the rough means.
Okay.
Shall I move?
Right leg bone 10 centimeters plus left leg also 10 centimeters.
Sorry, what did you say?
Left leg 10 per centimeters plus left leg bone 10 per centimeters.
Both are 10, am I right?
Yes.
Both means, that is 20. 10 plus 10, 20. You just report the code. 114, 44, 1.
Okay.
44, 1. Thus, the primary should be for first 20 primary. Each additional 20 are paragraph proper add-on. Did you understand now?
Yes, ma'am.
Did you understand? Please.
Yes.
Now, see the third example. Right leg bone 20 square centimeter. Left leg muscle 29. This is the same depth or different depth? Different depth. Comparing with the muscle and the bone, which one is the deepest depth?
Muscle. Muscle.
Bone is the deepest depth. Then next muscle, then the lowest depth is subcutaneous. Okay, the deepest depth is bone. Then next muscle, then the least is subcutaneous. So first here we have to report the code for deepest depth, bone. What is the code for 20 deep bone depth? 20.
11044.
20 square centimeter. Here, check that the code description, first 20 or less. So for first 20 square centimeter bone depth, 11044. Then muscle 29. How can we split that 29?
20 plus 9.
20 plus
20 plus.
20 plus 9. For first 20, 11043. Then the remaining 9, 11046. 11046. Here, during the same time, here we are reporting the first depth. That's why here we are appending modifier 59 with the lowest depth. So during the same time, at the same time, here we are reporting the code for deepest depth, bone code, and the lowest depth, muscle code. That's why we should append modifier 59 with the lowest depth. Understand now? Did you understand these 3 examples?
Yes. Yes.
Take it.
Ma'am, right leg bone square centimeter 28 plus left leg muscles 29 square centimeters.
Right leg bone 28.
28, yes.
Left leg
Left muscle 29.
Now try this, guys. Try this also. First, please try. I will explain you.
Okay.
Comparing with the Okay. 1 minute. 1 minute.
Noted? 1 minute, ma'am. Yes, ma'am.
Now, try this question now.
मेरे को मालूम था मेरे को 100% मालूम था
11044 and 11047.
अरे बोलते हैं
So the
We have already in double one zero four.
and 11046 along with the modifier 50.
So first bone depth, comparing with these two, the deepest depth is 4. So for we have to take the code as 3 8. Am I right?
Yes, ma'am. Yeah.
First 20 for the first 20 11044
11047.
Then next, what is the code? How can we split the code for muscle?
20 plus
9.
9. What is the code for first 20 muscle?
11043.
3 9 for 9.
46.
046. 59 modified.
Yeah, here we are reporting bone code and muscle depth. So we should up and modify 59. Fracture and dislocation. Skinned and subcutaneous means the depth is subcutaneous. See that in that end of the code description, they mention skin and subcutaneous. That means the depth is subcutaneous. Go for 11010. Muscle, that means skin, subcutaneous, muscle, fascia and muscle. So for muscle 11, for bone 12. For muscle 11, for bone 12. So these code section for debridement with foreign body removal at the open fracture and the dislocation. Direct one, no belly. And these code section for foreign body removal at the non-bone area. Sorry, debridement at the non-bone area. Debridement at the non-bone area. For the location of genitalia and perineum, go for 04. Abdominal wall 05. All of the above means go for 06. Genitalia and perineum 04. Abdominal wall 05. 06 for external genitalia, perineum, abdominal wall. All of the above means 06. So these code section.
Necrotizing, ma'am.
Sorry,
What is necrotizing, ma'am?
you have to tell me what is the meaning of necrotizing dead tissue.
Cell death. Cell death. Dead cells.
Dead cells, dead tissues. So that is called as necrotizing. Okay. Okay.
Okay, ma'am.
Did you understand the question? Did you understand, guys?
Yes, ma'am. Yes.
Okay. Take the key point regarding of debridement. renamed hyperkeratotic lesion. Example for hyperkeratotic lesion, corn or callus. For a single lesion, 110 For 2 to 4 lesion, 56. More than 4 lesion, 11057. So the procedure is paring or cutting. So for paring or cutting of hyperkeratotic lesion. Now try this. What is the code for 10 lesion? 10.
11057.
57. 3 lesion?
11056.
11056.
11056 for 3 lesion. For 10 lesion?
57. 7.
11057 for 10 lesion. Now biopsy. These are the biopsy: transitional biopsy, punch biopsy, and incisional biopsy. Transitional biopsy, punch biopsy, and incisional biopsy. Here, in this code description, in this code section, we have to report only one primary code. Actually, in that debriefment, we are reporting more than one primary code at the same time. Am I right? Okay. In this code description, actually for the entire CPT section, we can report more than one primary at the same time. For the entire CPT code section, we can report more than one primary. More than one primary. Like, so here we are reporting more than one primary. 11044 and 11043 is also the primary. So for the entire CPT codes, we can able to report more than one primary, but we have some exception cases. We have some exception cases. So for with a few concepts only, we can't able to report more than one primary at the same time. Take a note. In Intigumentary chapter, biopsy. In Intigumentary chapter, biopsy. Nervous system chapter, chemodenervation. Nervous system chapter, chemodenervation. We will discuss later about chemodenervation. In medicine chapter, vaccine toxide. In medicine chapter, vaccine toxide. Coronary therapeutic service. Coronary therapeutic service. Injection, infusion. Coronary therapeutic service and injection and infusion. So in Intigumentary chapter, biopsy. Nervous system chapter, chemodenervation. In medicine chapter, vaccine toxide, coronary therapeutic service, and injection and infusion. For all of these concepts, we can't report more than one primary. So take a heading with the heading, only one primary code should report only one primary code for all of these concepts. Should report only one primary code for all of these concepts. That means highest primary, lowest add-on. Choose the primary code from the highest. Choose the primary code from the highest. Choose the add-on code from lowest. Choose the primary code from highest and choose the add-on code from lowest. highest primary, lowest add-on. So now, in this, for example, 1102 for transitional biopsy, single lesion 1102, each additional lesion 1103. Punch biopsy 1104, each additional lesion 1105. Incisional biopsy 1107, each additional lesion 1106 for single lesion, for each additional lesion 1107. If a doctor just use a single technique, these are the three different techniques: transitional, punch, incisional. These are the three different techniques to obtain the sample. In that, if a doctor just use a single technique means report the code as usual. For example, punch biopsy. Doctor just use only one technique, punch biopsy, 5 lesion. How can we report? Punch biopsy, 5 lesion.
105
into 4. Super. So there are 5 lesion punch biopsy. So 1104 and 1105 into 4. Here, doctor just use only one technique. Now try the same one. Then the another example is incisional 3 lesion. Incisional biopsy 3 lesion. 1106, 1107 into 2. That's it. Okay, here we have to follow our regular method when a doctor use a single technique. Suppose if a doctor use more than one technique, how can we report means? So in this, the code sections are arranged from lowest dollar value to highest dollar. So for example, this is my imaginary dollar. So for a transitional biopsy, $100, punch biopsy, $200, incisional, 300. So the code sections are arranged from lowest dollar value to highest. So comparing with these three, which one is the highest intensive procedure?
Incisional.
Incisional is the highest. Then the next is punch.
Punch biopsy.
Then the
Punch
lowest is
tangential.
Now, suppose if a doctor use more than one technique means, how can we report? For example, punch biopsy.
Primary.
1 minute. Yeah, sure. 1. Punch biopsy, 3 lesion. Okay. Then transitional. Okay, I just give it. Transitional biopsy, 3 lesion. Okay, 3 lesion. Now, first, before you are going to select the code, first you have to decide which one is the highest here. Comparing with the punch and the transitional, which one is the highest?
Punch.
So punch is the highest. So as usual, we should report the highest code. There is no change. So punch 3 lesion. What are the code for punch 3 lesion?
1105 into 2.
So 1104 and 1104 here. So if you are going to report the highest code means there is no change. You report the code as usual. 1104, then 1105 into 2 for 3 punch. Now, transitional is the lowest. Am I right? Transitional is the here for the lowest. We should not report the primary code. You should not report the primary code. Which one is the add-on code for a transitional?
1103.
Just write that lowest one. 1103 into how many number of lesions are in transitional?
3.
Here, instead of primary code, we are reporting the add-on code directly. Okay, here reporting the add-on code directly. Now again I give one more example. Okay, so you are going to tell the answer. Incisional 5. Okay, incisional 2. Transitional 5. Punch 3. Now comparing with these 3, which one is the highest?
Incisional.
Are the codes for incisional?
1106. 1107 into 1.
Triple 106 and 1107. Am I right? These are incisional. 1106 and 4. So now I am going to report 1106 for first lesion incisional, then the remaining one lesion 1107. So there are 2 lesions in incisional. In that 2, there is no change. We have to report the code. We have to report the code based on our regular method. So there are 2 lesions. For first lesion 1106, then the remaining one lesion 1107. Then which one is the next highest? Comparing with the transitional and punch. For you have to directly report the add-on code only. Which one is the punch add-on code?
1103 into 5.
You just report 1105 and number of lesions are
3 into
3. Then what is the add-on code of transitional?
1103. 03 into 5.
So for the lowest add-on, choose the highest from highest primary, lowest add-on. For the lowest, instead of you just leave the primary, just write the add-on only, and based on the number of lesions, you have to apply the code. So punch add-on code 1105, and for 3 lesions into 3. So the add-on code for transitional 1103, and the number of lesion is 5, so that's why into 5. So that is the method of highest primary, lowest add. Did you understand? Any doubt, any question? Any doubt? Clear? Please say yes or no, guys.
Yes, ma'am.
Take this. Now take this. Now check that the examples are correct or not. Check that these guys noted or not?
Yes, ma'am.
Now check that the examples are correct or not. lesion 1106, one punch. So you have to report the add code directly 111005. And for a transitional by one lesion 1103. Okay. Did you understand? Is there any doubt in biopsy? Correct.
No, ma'am.
Very
No,
good.
ma'am.
Okay. Very take key point. Debridement and biopsies are a very, very frequently asked question. Very, very important. See that? These are the images for skin tags. For removal of skin tags, up to 15 lesions, from 1 to 15 skin tags, 11200. For each additional 10, part thereof, 11201. How can we report the code for 16 skin tags? 16.
11200.
Up to 50, 11200. Then the remaining one skin tag, we just apply the add-on code only one. Then how can we report the code for 35? 35. Yes, how can we split the code? 15 into 2 because we have to split it as 15 plus 10 plus 10. Here because the add-on primary codes are the upper limit of the primary code is 15, add-on code is 10. So 15 plus 10 plus 10. For first 15, 11200. Then remaining 2 tens. That's why 11201 into 2. Okay, this is our usual method. Then now please listen. Before that, take a note for the concept of very, very important. Use highlighter to highlight the words. If the for the concept of excision, for the concept of excision, shaving, and destruction. Destruction, destroy, D-E-S-T-R-U-C-T-I-O-N, destruction. For the concept of excision, shaving, and destruction, should report each lesion separately. Should report each lesion separately. For the concept of excision, shaving, destruction, should report each lesion separately. For example, 11300, the method is shaving. What are the anatomical sites are involved in this code description? Go and check with the guys. In 11300, the code, we can use this code for the anatomical set of trunk, arms, legs. So that means these code section can able to report for the anatomical location of trunk, arm, legs. Then check with the anatomical location of 30.
Scalp, neck, hands, and genitalia.
Hands, feet, genitalia.
Hands, feet, genitalia. Okay. Now, guys, please listen. Trunk 1 centimeter, leg 2 centimeter. Trunk 1 centimeter and leg 2 centimeter. Trunks and legs comes under the same group or a different group?
Same group.
Trunk and leg. Trunk and legs that comes under 11300. So that are present under the same group. So we should report the code separately. Comparing with 1 and 2, which one is the highest value? 1 and 2. So first we should report the code for 2 centimeter. For trunk 1 centimeter, leg 2 centimeter, 11302 for leg, 11301 for trunk. For leg, please take a note, leg 2 centimeter, leg 2 centimeter, 11302. For trunk 1 centimeter, 11301. Here we are reporting the code under the same code description. We are reporting 2 codes under the same code description. That's why we should up and modify to 59 with the second one. Here we are reporting the 2 codes under the same code description. That means under the same standalone code. That's why here we should up and modify 59 with the second one. So 11302, 11301, 59. Did you understand?
Yes, ma'am.
Suppose trunk 2 centimeter, neck 2 centimeter. Check that the group that are present in same or different?
Different.
Present in 300. Neck that are present in
305.
So we have to report the code separately, no need of modifier. So for trunk 2 centimeter, 11302. Neck 2 centimeter, 11307. Take the example, trunk 2 centimeter, 11302. Neck 2 centimeter, 11307. No need of modifier because we are reporting the code in different from the different code description. Clear? Any doubt? Now take the third example. Guys, please take a note. Trunk 1 centimeter, leg 1 centimeter. Check that. Trunk 1 centimeter, leg 1 centimeter. That are present in same group or different group?
Same
Group. Both are having the same value also. Am I right?
Yes, ma'am.
For the same group as well as the same measurement. So here, how many lesions? 2 lesions. One is present in trunk. Yes. Another one is present in leg. So 2 lesions. 11301 into 2. So here we are reporting the code based on the number of lesions. So 11301 into 2. 11301 into 2. Yes? Any doubt, team? Any doubt?
No need to append the modifier here, ma'am.
No, because actually into 2 is also reported with the 59 modifier also, am I right? So the methods are same. So the method, what is the code? 301
into
301 into 2.
301.
Okay. 1 into 2 as well as the both are same. The same code can be able to report 11301, 11. I am reporting the code 0159. Both are having the same data. We have to report into 2 or 59. okay, into 2 or 59. Should not apply the same method on the same. Okay, both are having the same data value, same meaning. 11301 into that means here we are reporting the code 2 times. Same like that here also we are reporting the code 2 times with the modifier 59. Both are having the same meaning, same data value. We have to use either unit symbol or modifier 59 concept only. Both concepts can't be able to apply at the same time. Clear?
Yes, no, ma'am.
Yes.